This episode is brought to you by my Fertility Management Masterclass. Master fertility awareness and improve your menstrual cycle health at the same time. Head over to fertilityfriday.com/workwithme for details. That's fertilityfriday.com/workwithme. This is the Fertility Friday podcast, episode number 123. Welcome to the 123rd episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Now, as you know already, I started this podcast because I believe that every woman has the right to know exactly how her body and her fertility works. And for those of you who are wanting to go deeper into the realm of fertility awareness charting and body literacy, I do have a number of programs that allow you to do just that. And I'm really excited to announce a brand new way to work with me. I'm now offering a one-time in-depth strategy session for those of you who are fairly confident in your charting, but still looking to gain a deeper understanding of your cycles. So for those of you who are wanting to go that extra step and get that customized interpretation of what your cycles are reflecting back to you about your overall health and fertility. And by the end of our 60-minute session together, you'll not only gain clarity and insight about your cycles and how they relate to your health history, but you're also going to leave with a plan, concrete next steps to take to improve your cycles naturally. So make sure to head over to fertilityfriday.com/workwithme to book your strategy session today. And today I'm very excited to welcome my guest, Dr. Marguerite Duane, to the show. Dr. Duane is a board-certified family physician and an adjunct associate professor at Georgetown University. She's trained as a Cretan medical consultant, and she is the co-founder and executive team leader of FACS, the Fertility Appreciation Collaborative to Teach the Science, which we're going to talk a lot about today. So for all of the listeners who have been listening for a long time, we always talk about fertility awareness education and how there's, obviously, and very often a gap between the knowledge, especially when you go to your physician. So one of the main goals of FACS, the Fertility Appreciation Collaborative to Teach the Science, was basically to educate physicians and healthcare professionals by using medical evidence so that they can also be a part of this process and empower women to take care of their fertility. So in today's show, we're going to be talking about FACS and the work that they do to raise awareness among doctors and other medical health professionals. And I'm so excited to delve into these topics. So welcome to the show, Dr. Duane.
Thank you. I'm delighted to be here today.
Well, thank you so much for coming on the show. I gave a small introduction. I'm sure it doesn't do justice because you've been in the field for so many years. So I'd love for you to share with the audience, just a bit about your background and as well what inspired you to delve into fertility awareness in particular and take the additional training to become a Cretan medical consultant.
Sure, I'd be happy to. So I think, like many of your audience members out there, as a woman, I'm very interested in women's health and wanting to care for my body and understand how my body works. And I'd always been drawn to medicine, and that was really my life's calling, and loved family medicine, loved the idea of caring for women and babies and husbands and siblings. And I did my residency training in Lancaster General Hospital in Lancaster, Pennsylvania. I had actually had a career before medical school, so I was a little bit older than some of my colleagues. But it was during my first year of residency when I was on OB call one night. And when I first heard about fertility awareness-based methods, it was the first time I'd ever learned anything about charting or knew that this existed. And it came about because as physicians, one of the things that it was drilled into us is when a woman would have a baby at the hospital, we had to make sure when she left with her baby, and part of her discharge instructions was making sure she had birth control on board so that she wouldn't come back, a year later expecting again. And so as I was getting my patients ready for discharge and writing their prescription for the birth control pill or the depot shot or the IUD, my senior resident who was on call with me that night, so why don't we talk about the impact of, birth control on the woman's side effects and effectiveness for preventing pregnancy in the postpartum period. And as we did, and we were talking about all the myriad of side effects that birth control can have, she said, there is a way that women can learn to manage their fertility without any medical side effects. And I said, how? She said, well, you can teach them about their cycle and about charting their cycle so that they can identify that window of fertility when they can get pregnant. And I looked at her and I was shocked. I'm like, what are you talking about? And she said, well, she kind of reviewed the menstrual cycle with me, in terms of the first half of the cycle being the follicular phase and the second half being the luteal phase, and ovulation occurs in between. And that really there was a very narrow window of time when a woman could conceive, and she could use, by learning to chart using a fertility awareness-based method, she could identify when that window was, and use that to prevent pregnancy or to achieve pregnancy or simply just to understand her body better. And as I said, my initial reaction was just shock. Like, how, as a physician, as a woman with an MD after my name, I didn't know anything about this. And I was one of those students in medical school that actually went to all of my medical school classes because I just learned better by being present and listening. And I thought to myself, well, I know I didn't miss this class in medical school because I was at all the classes in medical school. And I thought, how is it that I could have graduated as a physician not having heard anything about natural or fertility awareness-based methods? So that shock, then turned into anger. I thought to myself, I can't provide high quality, comprehensive women's health care if I don't understand this whole aspect of women's health. And so that really is what, for me, planted the seed and essentially changed the trajectory of my career, and began my focus on learning more about these methods. I learned them for myself, for my own personal use, and I learned about them so I could begin to teach patients. And then flash forward a few years later, I had learned about the Creighton model system and decided this was a great way for me to learn not only about charting and using fertility awareness-based methods from a family planning perspective, but seeing how charting can be used to address a range of women's health issues. And so I went through the Creighton training and was able to effectively use it in the medical center where I was the medical director to help a number of patients, mostly lower income, lower socioeconomic status minorities, people for whom artificial reproductive technologies may not be an option just from a financial perspective. We were able to help more than half of our patients seeking infertility treatment to have babies. These weren't young people. These were women in their late 30s. And in some of the cases, the issue was with the woman. In some, the issue was with the man. In some, it was simply teaching them when they could conceive. And so that's been very gratifying for me, both, from a clinical perspective. But let me pause and tell you a little bit about facts and what prompted the formation of facts. So here I am in practice for a few years using these methods in my clinical practice. As you mentioned, I joined the faculty at Georgetown University in 2004. I directed their family medicine clerkship. I ran electives for them. And then in 2010, I'd gotten an invitation from one of my colleagues to teach a small group elective. They were looking for volunteers to teach small groups on topics loosely related to medicine. And it was really up to the instructor to come up with the topic. And I had taught these small groups before. In fact, my husband, who is a fellow family physician, Dr. Kenny Lynn, he and I had taught a small group on Civil War medicine and how the Civil War laid the foundation for nursing and triage and much of how we approach medical care today. And I had also taught a small group on breastfeeding and the importance of breastfeeding and the basics of breastfeeding, etc. And so in 2010, when I got this invitation to teach another small group, I thought this would be such a great opportunity to introduce even a small group of first-year medical students to natural or fertility awareness-based methods. Because again, as a medical student, I had not learned a single thing about these methods. And so after much thought and consideration at the time, I was a medical director. I had 2 small children myself, and I realized it was going to be quite a bit of work to take on this additional task of creating this class. I was able to successfully recruit experts in many of the methods to join me in teaching this class. So Dr. Richard Faring, who developed the Marquette method, flew in from Wisconsin to give a 1-hour lecture on the Marquette model. Dr. Victoria Jennings, who's the director of the Georgetown Institute for Reproductive Health, where they've developed the standard days method and the 2 days method and the lactational amenorrhea method. She and some of her colleagues came in to speak to the students. Dr. Hannah Klaus, who is a renowned expert in the fields of natural family planning, and she developed Teen Star, which is about teaching adolescents to understand and appreciate their fertility cycle. She came and gave a lecture. So it was quite an amazing experience to be able to work with these experts in the field. But the best part was the response from the students. The students gave feedback such as, "This is the best class I've had at Georgetown thus far. this is such basic fundamental women's health information. Why isn't this a part of the regular medical school curriculum? And one of the students said, this is outstanding. I feel as if I can truly care for women in a more comprehensive, holistic manner. This is something every medical student should learn about. And I took that comment to heart and I thought to myself, she's right. I had the opportunity that year to teach 9 medical students. Well, there are 3,000 medical students a year alone in the US. So while it's great that I reached 9, there were still over 2,900 medical students that may or may not have been learning about these methods. And that is what led to the formation of FACS, the Fertility Appreciation Collaborative to Teach the Science. At that time, in 2010, I was on the board of another organization, the Family Medicine Education Consortium, which is designed to promote family medicine and primary care in the northeast part of the U.S. And the CEO, Larry Bowers, says he also likes to support the bright ideas of family doctors. So I came to Larry and I said, Larry, I've got this great idea. We should form a collaborative so that we can educate our healthcare colleagues about fertility awareness-based methods and the role that they can play in women's healthcare. Well, Larry and his staff at the FMEC have been completely and 100% supportive of our efforts, and we formed the FACS group under the umbrella of the FMEC, which is a 501c3 nonprofit, which is great because it's allowed us to accept donations for the work that we do. I was joined by a fellow family physician, Dr. Bob Motley, and together he and I formed FACS. Since its inception in 2010, now about 6 years ago, our mailing list has grown to over 1,000 people. We have had well over 100 physicians and healthcare professionals actively involved and engaged in our work to educate our colleagues. We're reaching medical students across the country. We're training speakers not only in the U.S. but in Canada as well to go out and give talks, medical talks to other healthcare professionals, as well as talks to the general population about fertility awareness-based methods. So I'd be happy to talk more about some of the detailed projects, but let me pause here, Lisa, and see if you had any specific follow-up questions before I go on.
Well, thank you for sharing and giving us like a really clear summary of how FACS came to be. I mean, when you were talking, I just resonate. And I think that there's no woman who's ever learned about fertility awareness and had the opportunity to learn the specific detail about how her body works that has not said, why isn't this just standard? Why are we not learning this? So from whether you're a doctor in medical school wondering why it wasn't taught to you, or whether you're a woman just on a Tuesday sitting around wondering, why wasn't this taught to me? And so, I mean, then the question becomes, how do we get the knowledge out? And what I love is that you just decided, you know, it wasn't out there in the world and you just created it. You just decided to found the organization. And so that's incredible. So I just want to say that I'm really appreciative that you're in the world and that you're doing your part to get this knowledge out. And I just wanted, you mentioned, you know, a few different doctors. And so for the listeners, I have not interviewed all of the, you know, medical professionals that you talked about, but I did do an interview with Dr. Victoria Jennings, and we talked about the standard days method. And so that was a really interesting episode. So I just wanted to point that out if any of the listeners, you know, heard that and are wanting more. So that's episode 77. And so I guess I kind of want to get into the nitty gritty a little bit in terms of the process that you use to educate doctors. So maybe you could talk about that a little bit. I mean, obviously, like one of the questions that you probably can't answer, but that might be on everyone's mind is, why isn't this part of the curriculum? So I know that that's kind of that unanswerable question, but I'll put that out there. But I also want to find out a bit more about how you go about actually getting doctors to educate. Do they come to you? Are you promoting it? Are you trying to get into the curriculum itself, or are you trying to collaborate with different medical schools to kind of create a more standardized process whereby more and more and eventually all doctors are going to receive this education?
Mm-hmm. So great questions. Before I begin answering those, I just want to follow up on your comment about, you know, as women experiencing that frustration and that shock of why haven't I learned this? And that's part of why, as I mentioned, Dr. Hannah Klaus and Teen Star, and that's an organization in which I serve on the board. And I'm deliberate about that because I really do think this is information we should be bringing to young girls and to young boys to help them understand their fertility and the changes that they're experiencing. So I'm a big believer that, you know, we should be teaching our adolescent girls how to chart their cycles. not necessarily from the perspective of a family planning, but just to understand the way her cycle works, to understand what the symptoms are that she's observing and what that means. So that would be my dream, to see these methods being routinely taught from the perspective of just appreciating our fertility and the way our bodies are designed. So let me move forward now to your question about why isn't this being taught in medical schools and to healthcare professionals. I have my own suspicions. Whether or not they're right or not, I can't say 100%. But from my experience as a physician and having gone through the medical education process, I feel as if much of our education is heavily influenced by the pharmaceutical industry and by the profit industry. And the reality is that when women learn to chart their cycles, there's not a huge cost to that. Other than like the Marguerite method, where you use the clear blue fertility monitor and may have to purchase test strips on a regular basis, once a woman knows how to chart, there's no real profit to be made. And I see, something similar with nutrition. I mean, we think about nutrition is integral to a person's health. Making sure that a person is eating a balanced diet and understands the impact of the foods that they're eating. Well, as a medical student, we had a 4 or 6 week course on nutrition on Friday afternoons for an hour or 2 hours. So it was very, very limited. And yet that's a huge part of what influences our health. And I think, that the same holds true, is that with nutrition, when you simply learn how to eat right, that's knowledge that you don't necessarily need somebody to give you something for. It's something that somebody's not going to profit from. So I think that's part of it. I think the other issue is doctors learn what they're going to be tested on and what they think their patients want them to know about. And at this point, until the board exams start asking questions about fertility awareness-based methods, doctors aren't going to feel they need to know that. And then the third piece is doctors learn what they think patients want to know about. And the reality is that most patients do not need doctors to teach them about their fertility. They can learn from trained educators, whether it be through Billings or Marquette or Justice, programs that have trained educators that can teach them. These educators do not need to be physicians or healthcare professionals even for women to learn about fertility awareness-based methods. But as doctors, I do think it's important that we understand what our patients are using so we can support them. And then finally, I think the other reason why doctors don't learn about these methods, and the area where FACS is really trying to focus our efforts, is that there's a huge misperception about the effectiveness of modern fertility awareness-based methods. The reality is that most physicians, when asked if they're familiar with different fertility awareness-based methods, will say that they're most familiar with the rhythm method. The majority of physicians, the overwhelming majority of physicians, have never heard of the Creighton model, have never heard of Marquette or symptothermal method or the Marquette method. FACS actually did a survey in 2011 or 2012 where we surveyed the women's health directors at family medicine residency programs. So these are the faculty that are responsible for teaching future family physicians about women's health and family planning. And our results showed that about a third of physicians were knowledgeable about fertility awareness-based methods, but when we asked them which method they were familiar with, the overwhelming majority said they were familiar with the rhythm method. And again, it was less than 5 or 10% were knowledgeable about any of the modern methods. So many physicians, if you ask them, will say, well, the methods aren't effective, so why am I going to teach them this? Because I don't want women to get pregnant. Part of the issue with the effectiveness comes with where we get our effectiveness rates. In the United States, one of the primary sources of medical information is the Center for Disease Control, or the CDC. And if you look at the CDC materials, they will say that fertility awareness-based methods have a 24% failure rate, meaning that couples that use these methods will experience pregnancy. 1 out of 4 couples using these methods will experience an unplanned pregnancy. Now, as a physician, if you dig deeper into that research, into that statistic, what you will find is that 24% effectiveness rate is based on a study published in the Journal of Contraception in 2011 by James Trussell. And what he did is he looked at the National Survey for Family Growth. And he looked at two consecutive surveys. I think it was done in 1999 and 2007. In these surveys, they basically call women up They call up 2,000 women and ask them if they got pregnant over the last year. And if they did, they asked them what form of birth control that they were using. And then they basically categorized that accordingly. So if a woman said she was using the Creighton method, she was using a natural method. If she said she was reading Taking Charge of Your Fertility, she was using a natural method. If she said, she only had sex on a half moon, she was using a natural method. So I joke about that, but the reality is they lumped all of the natural methods into one category. And what they found is when they asked those women who were using a natural method, fully 86% said they were using some sort of calendar rhythm method. So 86% were using a calendar rhythm method. Very few were actually using Creighton, Marquette, Billing, symptothermal. And so you can't combine all of the methods into one. A comparison is if they're calling up these women and they're finding out okay, who's using the mini pill, which is a progesterone only pill, they put those in one category. And then they asked which women were using Depo, and they put that in one category, even though Depo was progesterone. And then they asked women they categorized women who were using the Mirena IUD, which is a progesterone IUD. And they looked at effectiveness rates for those separately, right? Because the IUD works differently than the Depo shot, than the mini pill. So they're not combining all three of those methods because they're all quote unquote progesterone-based methods and saying there's one lump effectiveness rate. And as such, we shouldn't be doing that with natural methods. And so to address this,
can I ask you a question
Sure.
about that?
Absolutely.
And this might be a silly question, but I'm still going to ask it. So they took women who had gotten pregnant and then asked them what their birth control method was. Is that correct?
Yeah.
So, because then I think to myself, what about all the women who are using the method and didn't get pregnant?
Right.
And what about all the women who are even using the method to try to conceive and aren't getting pregnant?
Exactly.
It kind of plays into that myth that pregnancy can happen every day and it's just a snap of the fingers, and we have to, that what we were taught, what we were all taught as little girls, essentially, that no matter what, we could get pregnant all the time. So even that in of itself, the absence of the reality of the situation, which is that a lot of women are struggling to conceive, to still put I don't know, I think what I'm trying to say.
Yes, I do. And I think you raise a good point. I mean, as a research study, a retrospective recall study where we call people up and ask them what they were doing and then quote effectiveness based on rates, that would be as if I were to call up 2,000 patients and ask them, well, what blood pressure medication were you taking? And did you have a stroke or did you have a heart attack? I mean, that's not good quality research. Good quality research is enrolling in a large number of women and following them prospectively. And then, and you raised this important point, categorizing them by intention, right? Because in the contraceptive literature, they define success as not getting pregnant. Well, if a couple is using a natural method because they want to get pregnant and they get pregnant, that's not a failure in their mind. But from the way the contraceptive literature looks at it, they look at it as any pregnancy as a failure. And that creates, this confusion. So for instance, one of the things that FACS did, one of our earliest projects, was we decided to look at all of the research that has been done on fertility awareness-based methods since 1980. We looked at every single study and we rated them based on the size of the study, based on control for sexual activity, i.e., were women actually charting that they were sexually active? Because if a woman wasn't ever having intercourse, then how do you know if the method was effective? So we wanted to make sure that they were sexually active. We wanted to make sure we were following them, that the studies followed these women prospectively. And some studies looked at intention, but it was interesting because for some of the studies, like the studies of the symptothermal method, which has the highest quoted effectiveness rates, they asked the couple at the beginning of each cycle, at the beginning of every month, what is your intention? Are you trying to avoid pregnancy or are you trying to achieve pregnancy? And if at the beginning of the month the couple said they were trying to achieve pregnancy, they took them out of the study to look at the effectiveness for avoiding pregnancy, right? Because they're trying to get pregnant. If they got pregnant, from the couple's perspective, that's a success. And they didn't want that to confuse the data to see how effective the method was at avoiding pregnancy. So that study done of the symptothermal method done in Germany shows very high effectiveness rates of the symptothermal method. The highest quality study of the Billings method, which was done in India, basically asked women at the beginning of the study, were you trying to avoid pregnancy or achieve pregnancy? They didn't go back and ask the women, 1 month later, 3 months later, or 6 months later. So a couple might have changed their minds, but that didn't come out. And so as a result, the billing studies, the effectiveness rates are lower than the symptothermal method. But I never tell patients, well, you should use the symptothermal method because it's more effective. What determines effectiveness of a method is, are you learning the method from a trained educator? Are you following the instructions of the method? And are you motivated? Both you and your partner, are you both motivated to avoid pregnancy? If all three of those things are in place, I think you can very much approach the correct effectiveness rates for the natural methods, which is less than one unintended pregnancy per 100 women years for most of the major methods, Billings, Creighton, symptothermal, Marquette. So that was one big project. And that research study is actually available on our homepage of our factsaboutfertility.org website. The good news is that for each of the methods, there was at least one high quality study which showed effectiveness rates comparable or even better than the birth control pill. But the sad thing is there's not a ton of research done. So many of these methods only had one or two studies that were high quality that had been done. But that research is available, again, on our factsaboutfertility.org website.
Well, we can, I will link to that in the show notes page. And I think what you're talking about brings up something for me. And it's something that was also discussed. I think we mentioned it. We were talking pre-chat before the show. And I mentioned that I had done an interview with Dr. Miranda Naylor. And, we kind of dissected what the perspective of your doctor so that we could better understand where your doctor is coming from. And one of the themes that has come up in, several of my interviews with doctors is that just like what you said about pregnancy being considered to be a failure. And so then in terms of prescribing birth control methods as a physician, it's kind of like you're trying to get the best mark on the test. So you're not going to give the medication that doesn't have the 99% because that would be a failure. And so, one of the important pieces of work that you do with facts is to educate doctors about the actual, science. How does the woman's body work? How does the fertility awareness method work? What is the effectiveness? But how do you get over that hurdle of, a doctor knows that a fertility awareness-based method is entirely, quote unquote, user dependent. There's with an IUD, you can't really do a whole lot to screw that up. Right. Other than take it out, which some doctors won't even allow their patients to do when they want to get it out. Right. But how do you get over that hurdle?
Yeah, that is certainly one of the biggest challenges. Fertility awareness-based methods, like the birth control pill, like the condom, those methods require patients to modify their behavior. It requires a woman to do something on a daily basis to manage her fertility, as opposed to the IUD or sterilization. And once you have the IUD in, it can be effective for up to 5 to 10 years. But what we're finding is many women do not like the side effects associated with it. Many women really struggle with the thought of having a foreign object inserted into their body and walking around with that for 5 years. But I agree. Many of my physician colleagues will say, you know what? And again, I've always cared for, I've worked community health centers, primarily cared for low income and minority populations. And my colleagues will say, well, they can't possibly figure out how to manage their fertility. It's too difficult for them. And we should just put an IUD in them because then they don't have to worry about it. And personally, I think that's incredibly insulting to women, regardless of her literacy level. And in fact, as I mentioned, the Billings study, which was done in India, was done in an almost entirely illiterate population. And yet these women can learn to chart their cycles very, very effectively. And so what I say to my colleagues who say, well, the IUD is just the safest because then the women don't have to think about it and they're not smart enough or they're not going to remember to check every day anyway. I ask my colleagues, well, what do you do when you have a patient with diabetes? When a woman has diabetes, she needs to watch what she's eating every day. She may need to check her blood sugar. She may need to take medicine. She may need to exercise. I say, do you just tell them, you know what, you can't possibly learn to manage all that. So I'm just going to insert an insulin pump and control that for you because you're not smart enough to figure it out. No, we don't. We say, this is a challenging this can be challenging. It requires daily, attention to your body. It requires modifying your behavior. And so I'm going to support you. And I've got a diabetic educator here in my office that I'm going to have you meet with after our meeting so they can review with you what you need to do. And so I tell my colleagues, fertility awareness-based methods, is similar. We should have, as physicians, fertility educators in our office so that we can refer women to them so that they can learn to chart. Not only, again, from a family planning perspective, but as a physician, that chart is, I refer to it as the female cycle as the fifth vital sign. It reveals a wealth of information about her health. In fact, I had a colleague of mine, another family physician, who actually diagnosed a pituitary tumor based on the woman's charting. She saw certain patterns that she thought, that raises suspicion about some hormonal abnormalities that could be related to the pituitary. She asked appropriate questions like, are you having headaches? And the 20-something-year-old college girl was like, of course I'm having headaches. I'm in college. I'm under stress. Like, who doesn't have headaches? And the doctor was like, okay, what about your vision? Are you having any visual issues? Any problems with your peripheral vision? And the young woman was like, well, yeah, I guess, but I didn't really think it was a big deal. Like, the woman had them put together, but because of what my colleague had seen on her chart, she was able to ask the appropriate questions, was able to get that young girl in for an MRI that showed she indeed had a pituitary tumor. So she was able to have that diagnosed at a much earlier stage. And it stemmed from the information that was revealed in the woman's chart. And so as physicians, I tell my colleagues, regardless of whether or not you want to use this for family planning, we should be encouraging every woman to chart her cycle simply from the perspective of this provides valuable information both to the woman. What woman wants to get surprised by her period, right? How many of us have been on vacation or, planned this great night out and then all of a sudden, oh my goodness, I didn't realize my period was coming today. Whereas when a woman charts her cycle and she understands the length between her ovulation and her period, she can begin to predict with pretty good accuracy the day that her period's going to come so that she can be prepared. That's something perfectly appropriate for teenagers to be able to learn how to do. And so I encourage my colleagues, look at fertility awareness-based methods as not just a family planning method, but really as a way for women to truly be empowered with knowledge about their health. Unfortunately, as physicians, we're not trained that way. As a physician, when I went through medical school and residency, for the most part, I was trained to view most women's health issues as a problem, and the pill is the panacea to cure all that ails women. If a girl has painful periods, give her the pill. If she has irregular cycles, give her the pill. If she has pimples, give her the pill. It didn't matter what the woman would present with, the idea being, well, if we give her the pill, it will fix things, quote unquote. Well, in reality, the oral contraceptives and hormonal contraceptives, when used as birth control, while it may suppress symptoms, it may not treat the underlying pathology. So if a woman is having painful periods because she has endometriosis, she may go on the pill and the pill will suppress her hormones, so those painful periods will not be as prevalent. But as soon as she goes off that pill in her early 30s, because now she wants to try to conceive a baby, the endometriosis is still there. The potential effect on her fertility is still there. And yet it's 5, 10, 15 years that it's gone untreated, truly untreated. And so to use the pill as a panacea, I think is very, it's very unfair to women. In reality, I feel like women's health research essentially halted once the pill came on the market. And there have been very few physicians, save Dr. Hilgers with Creighton and Napro Technology, Dr. Faring with Marquette, Dr. Mary Martin with Billings, that have really looked at how can we truly treat women's health problems. And to do so, let's use the information that the women can reveal by charting their cycles to help guide the management, the diagnosis, and the treatment of a range of women's health issues.
Well, one question that I always have this question, because as a fertility awareness educator myself, who I work with clients and I obviously teach them to chart their cycles. And as soon as you enter that type of role, then you're also able to see chart abnormalities fairly obviously, right? And so
Yep.
then, so, all the women listening, let's say they're all like on board. They're like, yes, oh my goodness, I'm so excited. I can't believe I didn't learn this information. I'm going to go out and chart my cycles. Yes, Dr. Duane, I'm on board. And then they go to their doctor and their doctor isn't on board. So do you have, do you have any practical kind of just information for the women out there, because they're not being served by their physicians? And I see it all the time, meaning that as a fertility awareness educator working with a client, I am the first one to ever say, have you ever been tested for PCOS symptoms? Like no one else has, and no one else has ever even. And I check in with my clients, have you ever seen a doctor? Did you ever ask your doctor about your periods because you've noticed that they've been irregular and etc.? Oh yeah, I asked my doctor and my doctor told me it was completely fine.
Right. And the reality is the overwhelming majority of physicians are not knowledgeable about fertility awareness-based methods. The most recent study, which I think was done in Canada, showed that only 3 to 6% of physicians are familiar and knowledgeable with fertility awareness-based methods. And so I imagine many of your listeners have had incredibly frustrating experiences going to their doctors only to have their doctors dismiss them and not have any knowledge of what their chart means. When I talk with my colleagues about the chart, and again, if they're not accustomed to seeing it, they don't know how to interpret it. I describe it as like a woman's chart. To me, as a physician that's trained in fertility awareness-based methods, can reveal a wealth of information, just like a woman's EKG can reveal a wealth of information to a cardiologist, or to a well-trained family physician or internist. When you're trained to read EKGs, you can look at that EKG and it can tell you a wealth of information if the person has has an arrhythmia or has an enlarged heart or may have some other electrical abnormalities of the heart, because the cardiologist is trained to do that. Now, you probably wouldn't take your EKG to the radiologist to read it, right? Because the radiologist doesn't read EKGs day in and day out, Just like you're probably not going to take an MRI to your sports medicine doctor. Well, that's not true, because sports medicine doctors, when it comes to to extremity injuries, do read a lot of MRIs. But you might not take an MRI to your OB, because the OB may not read a lot of MRIs. And so if you're taking your chart to a physician that's never been trained in fertility awareness-based methods or doesn't know about them, they're going to look at it and it's not going to mean a whole lot. So the first thing I would encourage your listeners to do is to be patient with your doctors, because honestly, I was that doctor that didn't know anything about natural methods early on in my career. One of the things that amazes me and gets into women's health issues, as a fertility educator, you understand one of the signs you teach women to chart is her cervical fluid secretions. And as a woman's estrogen is rising in the days leading up to ovulation, during that very narrow window period of fertility, like you said, we're not able to get pregnant every day. It's really a 3 to 6 day window that women are able to conceive. Then we teach them about the cervical secretions. Well, as a physician, I remember being trained to think that any vaginal discharge is likely an infection, right? And if a woman is coming in with a complaint of a discharge, you need to test her for STDs. And keep in mind that STD testing can be negative, so you may want to just prophylactically treat anyway, because in all likelihood, she probably has a sexually transmitted disease. I remember once I learned about cervical secretions, I shuddered at the thought of how many women did I treat for an infection, quote unquote, when what I was actually seeing was her normal cervical secretions. And I had this experience once I knew about these cervical secretions. I can tell you 2 patient experiences. One, I had this couple come in to me because they were struggling to get pregnant. Again, she was 27, 28, so she should have been perfectly fertile. Her husband was 32. He had had a child from a previous relationship. So this woman was devastated, and she really thought there was something wrong with her. She said they'd been trying for over a year. So she met the classical definition of infertility. And if I was any other doctor, I probably would have said, well, you've been trying randomly for a year and you haven't gotten pregnant. Let me refer you to an infertility specialist. I didn't do that. I took her history. And in taking her history, she had very normal menstrual cycles. And I asked her about her cervical secretions, and she said, yeah, she would get this frequent infection. She said almost monthly, where she would get this discharge. And she said, whenever I got this discharge, my husband and I don't have sex because I don't want to give him whatever it is that I have. As she described this discharge, I realized what she was describing was her normal fertile cervical mucus. And what she was explaining to me is she was avoiding sexual relations with her husband every month when she was fertile.
Pretty effective birth control
she didn't
method.
know. It was very effective. And I explained to her, saying, but we've convinced women that anything that comes out down there, that must be a bad thing, right? Whether it's your period or a discharge or a baby, it's bad. And so blah, as opposed to teaching her. And this is what I did. I said, this is what's happening. I explained how it worked. And I said, humor me. Next month, when you have this discharge, have sex with your husband. I said, I can guarantee you the only thing you will give him is a baby. And they came back 2 months later pregnant. And they thought I was a miracle worker. But all I did was teach her how her body worked. And again, I shudder at the thought, if I was any other doctor, how far down the artificial reproductive technology path would she have gotten, with all the potential side effects and ethical implications associated with that, when all she needed to know was how her body worked. Another example was a patient that I had, again, coming in with this recurrent infection. She wasn't sure if she had bacterial vaginosis or chlamydia or something, and she kept coming in. And after the third month and having charted out her cycle with her in my office, essentially going through her dates with her on her calendar, I explained to her, this is not an infection. This is your normal cervical fluid. Your body produces this. This is how your reproductive system is designed to work, to produce this fluid. And she looked at me and she said, well, just can't you give me something to make it stop? And I said to her, because again, she was convinced that this was something bad. I said to her, I said, well, sure. I said, but that would be like me giving you something to make your saliva dry up. I mean, your saliva is produced, the spit is produced as a part of your normal digestive process. I could do that, but it's going to negatively impact the way your digestive system is supposed to work. Just like making this mucus dry up would negatively impact the way your reproductive system is supposed to work. So it's just, we don't educate women. And again, as doctors, we are not educated. So for your listeners out there, I would encourage them. FACS is working very hard to get this information to medical professionals. And we've actually partnered with an organization called Natural Womanhood to produce a medical update, which provides a brief overview of fertility awareness-based methods. And it includes the table from our research study, which shows the effectiveness of each of the methods. This is really designed to be given to healthcare professionals so that they can learn a little bit more. And then once they begin to open up their mind to, oh, maybe there's more that I need to know about this, then we encourage them to either attend one of our FACS lectures or view our presentation online. I will tell you, I referenced earlier the survey that we did of family medicine residency programs and their women's health directors. And that study was actually led by one of my FACS colleagues, who's the director of the women's health program in her residency. And she was very interested in doing this study because she came to the very first FACS meeting. And she came because she said, Dr. Duane, I'm passionate about women's health. I direct women's health at my residency. I'm on the board of Planned Parenthood. I want to make sure my residents know about all the family planning options that are out there. She said, but when I read the description of your workshop, she said, I realized I had never heard anything about these methods. And she came to that first workshop, and in the beginning she was skeptical, and she was like, well, why not just use IUDs? And she understood, by teaching women to chart their fertility, it's great for family planning and it's great for women's health monitoring. At the end, she was like, I think every woman needs to learn about these methods, and every doctor does. And so she has invited me to come up and give our FACS presentation every year to her residents. The FACS presentation is a 1-hour introduction. It's an overview to the science of fertility awareness-based methods, and we briefly introduce each of the evidence-based methods. So we go through cervical fluid methods like Billings and Creighton and the 2-day method. We go through cross-check methods, including the symptothermal method and the symptohormonal or Marguerite method. We teach them about the standardase method as well as the lactational amenorrhea method. And we share the effectiveness of using these methods to avoid pregnancy as well as to achieve pregnancy. That presentation is already approved through the American Academy of Family Physicians for 1 continuing medical education credit. And FACS has now trained over 50 speakers, including 2 in Canada, Geraldine Mattis, who founded Justice, and Dr. Martin Owen, who's a family physician in Canada. We've trained now over 50 speakers to give this presentation. We can give it to physicians, to nurses, to midwives, to medical students, to pharmacy students, to any healthcare professional that's interested in learning more about fertility awareness-based methods. So if people are interested in inviting in one of our FACS speakers, they can certainly reach out to us via our email, info@factsaboutfertility.org. And we've also now developed a presentation that introduces fertility awareness-based methods to the general population, to women, to men, to people that are interested in learning more about that. And again, our speakers are trained to deliver that talk as well. So for your listeners, please download our medical update, share it with your physician, ask them what they know. Don't be discouraged or surprised or skeptical when they say, well, that's just rhythm and that doesn't work and you shouldn't be using that. What I tell people is the rhythm method was actually developed in the 1920s, 1930s. So we're talking 80 or 90 years ago, 40 years before the pill came on the market. At the time, the rhythm method was the best science that was available. But since then, science has evolved. The Billings method was developed in the 60s, Creighton in the 70s, Marquette in the 90s. So the science has evolved, and we use the modern methods. And so I say to my medical colleagues when they say, well, that's just rhythm, you can't be recommending that. And I tell them, this is a question for your listeners to consider. Do people realize when the first antibiotic was developed, right? Prior to the antibiotic, or the way we treated infection was somewhat barbaric. Leeches, having people, get really, drink lots of fluids, your grandma's chicken soup. That's how we treated infection in the pre-antibiotic era. Well, the first antibiotic was developed in the 1940s. And I tell my physician colleagues, we don't treat infections like we did in the pre-antibiotic era. Why are you talking to your patients about a method that was developed 90 years ago when there are modern methods? And as physicians, I think it's incumbent upon us to learn about these methods, to understand how they work, and to empower women and encourage women that are interested in using these methods. Again, whether it's for family planning purposes or simply for health monitoring and managing a range of women's health issues.
One question I wanted to ask you was kind of about, it kind of ties into a lot of the different things that we've been talking about. But one of the things that I find, whether it's with health professionals specifically or with women in general, is that, and I think a little bit more so with health professionals, is that when you bring up the idea of, fertility awareness and educating around a woman's menstrual cycle and how her reproductive system works, I often find that a lot of, more so health professionals, but in general, a lot of women kind of think that it's super easy to learn. So, for instance, someone will reach out to me with kind of whatever professional background and kind of have that assumption that, well, I'm already I already have this certification, or I'm already a doctor. So really, I couldn't need more than an hour overview. So kind of this idea that this is super simple and it's way overkill to really give it more time than that. I hope I'm making sense, but I feel that people underestimate how complex and intricate the system is. And so one of the things that I wanted to ask you was about your training through Creighton. So you were already a doctor. You had already gone through medical school. So you have already learned about reproductive anatomy, the body, the hormonal systems. I can't even list all the things that you've learned because I've never been to med school. And so when you went ahead and took the Creighton training, I want to know how long it was, and I want to have an understanding of how much more you learned than you already had been taught.
Sure. And I want to divide this up into two parts. One, for the person learning these methods. And I think you make a great point that people that, may already have a healthcare background or a knowledge of reproductive health may think that learning to use the method themselves is very easy. And so they don't necessarily think they need to take the time to learn effectively from a trained educator. But I would say they absolutely do, because the key with using these methods effectively, especially if you're using it from a family planning perspective, is being able to make those daily observations and interpret them and recognize that if anything is going to affect your cycle, it will almost certainly affect the first half of your cycle. Meaning if you're under stress or, you've been sick and you're not eating as much, if that's going to affect your cycle, it's going to affect it in the first half. And if you make a mistake, then that's when you're most likely to get pregnant. And interestingly, there was a Billings study, and I think it was the China study. It was actually a comparative trial of the Billings ovulation method versus the IUD, and it was done in China. It was a large study. They actually found the Billings method to be more effective, and I think they had about 700 patients in the Billing arm and about 400 patients in the IUD arm, and 2 of the Billings patients became pregnant and 5 in the IUD arm became pregnant. And the 2 women in the Billings arm actually were highly educated, whereas the overwhelming majority of women in the Billings arm were of very low literacy. And I think, there's something to be said to that. I mean, people that may not have as much background realize, I need to pay attention to my teacher. I need to listen to what she's saying. I need to follow the guidelines. Whereas people that, may think they know it all are more likely to overthink it or to say oh, I don't really have to pay attention to that part. And so they may be a little bit more dismissive. So I'm a strong believer. And for me personally, I learned how to chart from a trained teacher, even after I was a physician. And I think that's important, regardless of your quote unquote background knowledge. But in terms of learning to integrate these methods into my practice, I think you're right. I mean, as a physician, we're trained in reproductive physiology, but what we don't learn about is the relationship between reproductive physiology and fertility awareness-based methods. And really, we think about a woman's health organs, we think about the ovaries, and we think about the uterus as being, the primary reproductive health organs. But what's often overlooked is the incredibly important role of the cervix and the production of cervical fluid and how that affects fertility and how it can impact infertility. And as physicians, we don't really learn about that, and we don't really learn about cervical fluid. There is a scientist, Dr. Eric Odeblad, who has, since the 1950s, spent literally the last 50 to 60 years studying the cervix and studying cervical fluid and the important role it plays in both pregnancy prevention and conception. And much of his work is not out there in the mainstream medical literature, which is really, really unfortunate. Through the Creighton training, specifically, you asked in terms of the length of time. As a medical consultant, the training goes over a 1-year period of time. There's specific weeks that you dedicate in lectures, learning the latest science. And then the idea is you then apply it practically in the clinical setting. In addition to Creighton and NAPRO technology, there are newer medical approaches being developed. As I mentioned, the Marquette method has training specifically available for healthcare professionals, and they actually do much of their training online, which is fantastic. And then there's a newer one called FEM, which stands for Fertility Education and Medical Management. And they're also developing protocols. They're working with Dr. Pilar Vigil, who again is a renowned researcher in the world of fertility awareness. She's been doing this for 30 plus years through their Reproductive Health Research Institute to begin doing the studies to look at how can we positively impact women's health using her chart as a guide to the diagnosis and treatment of women's health issues. And so there's different avenues for physicians to learn more about this. As OBs, they probably get even more of this again in their regular training, but they may not necessarily learn how this applies to using fertility awareness-based methods to approach women's health. But when they learn it, when they hear about it, oftentimes it does click that, oh yeah, I remember learning about that, but not necessarily making the connection. In fact, I've been through both the Creighton training as well as the FEM training. And when I did the FEM training, I was there with a reproductive endocrinologist, and he commented to me, he's like, I remember learning all about this from the perspective of a reproductive endocrinologist and how to manipulate the hormones and, to medically approach women's fertility, as opposed to using this information from a more proactive or procreative perspective, by working with the woman's body instead of the way traditional artificial reproductive technologies work is they often will suppress the normal functioning of a woman's body to help her achieve pregnancy, as opposed to figuring out what's wrong, what isn't working for that woman, how do we fix that underlying problem? And that's what NAPRO and FEM and Marquette seek to do. They seek to figure out what may not be working correctly, not only with the woman's body and the man's body to affect their ability to conceive. Another, case in point, I mentioned earlier that as medical director for this community health center in Washington, D.C., where we served an almost exclusively uninsured, lower income, lower literacy population, we had 24 couples that sought treatment for infertility from us. Of those 24, we had 14 that actually gave birth to a live baby, which is huge. And that's important when you're looking at success rates, right? So with Creighton, with NAPRO, they look at success not at, number of, pregnancy rates, but live birth rates, because a woman can get pregnant and then miscarry. And that doesn't really address her issue with infertility. I mean, what she wants is not merely pregnant, she wants a baby. And so there's actually 2 large studies of NAPRO technology, and both of those resources or references are available on our website that look at using NAPRO technology to address infertility. So they've done it in larger studies. And as I said, we did it in my clinic. And one of the couples that we treated, I'll never forget, the woman had beautiful cycles. She had just incredibly regular cycles. She had a good mucus buildup. I mean, she looked like she shouldn't have any problem with getting pregnant. And so we began to investigate the male. And what we discovered, interestingly, in terms of looking, one of the things you do with male infertility is look at a semen analysis. And we had one study of his semen that looked fairly good, but then we had another study where the semen was very poor quality. And in getting the history, we discovered that he was a truck driver, and he often would ride for long periods of time, and he also wore very tight underwear. So what we discovered is that, he was basically overheating his testicles. And if you know anything about male fertility, sperm need a lower temperature than body temperature to be able to survive. And it turns out he was driving a lot during his wife's fertile time. And so we basically told him, next month, you need to take off a few days before that fertile window to give your body a chance to produce healthy sperm so that they could conceive. And they were able to do it. And again, it was a matter of we had the woman's chart, we could tell a lot about her health, and then we investigated the male factor, because we often think fertility or infertility issues are the woman's problem, right? I mean, family planning, that's the woman's responsibility. The reality is whether you're going to have a baby or not have a baby, it takes 2 people. It's really a shared responsibility. And we need to look at addressing, both the male and the female, and figuring out what's working and where the issue may be, so we can appropriately and effectively treat that.
Mm-hmm. Well, I really appreciate you sharing the examples throughout our interview today. I know that you've blown a lot of women's minds with your information. I know that for a fact. So thank you for that. And I mean, the reason that I wanted to ask you the length and duration of the program that you took, and you explained beautifully just that kind of overconfidence and slight arrogance that can come from, this is not to say, if I was a doctor and I went to medical school, other than the fact that who knows how much I paid for that education, it's a very expensive piece of paper that you hang on your wall, right? Doctors go to medical school to make a difference. You'd be hard pressed to find a doctor who isn't really concerned about the quality of care that their patients are getting. This is the reason why people are doing that. So, and it's interesting how you spoke about how that can work against you, because what I always say is that you don't know what you don't know. And so I find that to be,
Exactly.
Yeah, and I find it to be an interesting challenge in the field that I work in, because for some reason, women's health doesn't get the attention that it deserves. And that lends itself to this idea that it must be simple. And so you described the different programs. The Justice program is a 2-year program to become a fertility awareness educator. 2 years. And it's not 2 years of easy work. It's 2 years of intense study. And so then the question would, that lends itself to the question, well, what is to this method so much that it would require that degree of education? And, how is that even possible? And that's where the conversation starts. And so I think that for the listeners who were really intrigued by this conversation and want to learn a little bit more about how the menstrual cycle chart can be applied as a diagnostic tool, Dr. Duane, we talked a little bit in our pre-chat that previously I did an interview with Dr. Danielle Miller. So that's episode number 31. And she is also a Cretan medical consultant. And so that interview, I would definitely suggest for you to go and take a listen, because we really delve into some of these topics in a little bit of a different way in that interview. And I guess I just wanted to kind of bring it back to something that you said, which it really disturbs me. So that's why I'm bringing it up again. But the importance of having the basic fundamental knowledge, it really scares me to think that, and it's interesting because when I interviewed Katie Singer, author of The Garden of Fertility, she shared a similar experience to what you described. And that was that your patients would come to you kind of monthly, or come to you saying, I get this, infection every month. And it lends itself to the question, how many women have that exact experience that are given antibiotics, that are, and the way that you were able to support these patients who literally make that one change and became, pregnant because they just didn't understand the way that their body works. I feel like that in of itself is kind of a good note to end on, the importance of having this basic knowledge that we all should have. I mean, it almost speaks for itself.
Yep. I absolutely agree. And, I think that's an excellent point to end on. I will say, as a family physician, I wanted to comment on something you said earlier. As a family physician, we care for people of all ages and all walks of life. And early in my career, I even delivered babies. But I've always taught my students that it's critical to know what you know and know what you don't know. And if you don't know, seek the truth. Look for the answers. Find the research. And that's why we've started Facts. And that's also why we launched originally focusing on educating physicians and healthcare professionals. But I'll be honest, they're a difficult audience to reach because they're already very ingrained in their practice ways. And so Facts has shifted our efforts now to focus on the students, on the medical students, the nursing students, the midwifery students. And we now have a student ambassador program. So if you have any of your listeners that are healthcare professional students and want to help us share this information with their classmates, with their colleagues, again, we would encourage them to get involved, because I think it's important that we reach them before they become so ingrained in the traditional medical mindset of treating the woman's reproductive health system, treating women's fertility as a disease, and suppressing it with drugs or disabling it with devices. The reality is the woman's fertility, the woman's reproductive health cycle is this incredible orchestration of hormones that gives us energy. And I just read an article today about how in the days leading up to ovulation, the woman's brain actually grows because of the impact of estrogen. And, when we don't allow a woman to cycle normally the way she was designed to, I don't think we can fully appreciate the incredibly detrimental impact that can have on women, throughout their lives. I mean, there's great programs like yours. There's books like Sweetening the Pill, how women are hooked on hormonal contraceptive, that highlight how our healthcare industry has really done a disservice to women by not educating them to understand how their fertility cycle is designed to work. So I am delighted to be able to work with so many amazing fertility awareness educators. And I'm thrilled to have people like you, Lisa, that are out there educating women. And I encourage you to help Facts by, putting pressure on doctors and say, you need to do your due diligence and learn more, and refer them to Facts. I mean, we welcome people from all specialties, from all methods. I think that's one of the things that's unique about Facts is that we promote all of the fertility awareness-based methods as long as they have solid scientific evidence to support their use, because that's how we're going to convince our medical colleagues, by saying this method has solid scientific research that supports its use, whether it's for family planning or women's health. So that's our goal. I really appreciate the opportunity to share with your listeners, to share what we're doing. I would encourage, again, your listeners to visit our website, to like us on Facebook, and to follow us on Twitter, and to help us spread the word and encourage our fellow healthcare professionals and healthcare professionals in training to learn more about fertility awareness-based methods to see how we can really empower women in the care of their health.
Well, absolutely. And before we end today, I have a couple of wrap-up questions. I wanted to comment on one of the things that you mentioned, which was the download that you can, give to your doctor. And it's interesting because as you were talking, I just had this kind of imagination of somehow like flyering the entire world and giving women, every woman who wants to seek support from their physician about their reproductive health, to have them go in with a pamphlet so that made by doctors for doctors in their language, something that maybe, I know obviously it wouldn't work in all cases, but I just had this imagination around that as you were talking. And so then you said that you have a download that women can hand to their doctors that shares more about the effectiveness and some information about the methods. And I thought, oh my goodness, that would be it is so necessary. I think it's really challenging for women to seek the support they need. But yeah, so to wrap up, I have a couple of questions for you. And the first one is, we talked about a wide range of topics on today's episode. What is the one thing that you would want the listeners to take away from our conversation?
I think the one thing I would want your listeners to take away is to not be discouraged in their use of fertility awareness-based methods, even if their doctors are dismissive. To understand that, many doctors are simply ignorant because they may not have learned about this in their training. And again, because organizations like the CDC promote inaccurate research that quotes much lower effectiveness rates. And so one of the things that we need to do is pressure the CDC to update the research and make sure that the information is being communicated accurately and effectively. And then personally, in terms of their use of the methods, facts says that the best method is the one that's going to work best for you. And that may be different methods at different points in your life. The most important thing is that you learn the method, ideally from a trained educator, and that you're motivated to use it correctly. And to do that, it's so important to work with your partner in sharing that responsibility so that together you can use the method depending on your family planning goals. So I think those are the key points. And again, I just encourage them to be citizen activists and help us. The medical update we produced is really because, we don't have the funding of a pharmaceutical company. As I mentioned, we're a very small nonprofit, and most of the people that work for FACS do so on a volunteer basis. So we don't have pharmaceutical reps that can go out and detail doctors, but you as listeners, as patients, can share our medical update with your doctor and help us to change the knowledge base of physicians around the issue of fertility awareness-based methods.
Okay, well, those are amazing words to end on. Dr. Marguerite Duane, thank you so much for coming on the show. I really appreciate your time today. And it was just such a treat to be able to talk to you and to get that sense of hope, because you're out there educating doctors about fertility awareness-based methods in a way that they can truly appreciate and apply into their practice. And it's such an inspiration for me. And, on behalf of the Fertility Friday community, we thank you for your work and your service.
You're welcome. Thank you.
And so for the listeners then, you mentioned the FACS website. So maybe just reiterate then where the listeners can go for more information.
So the FACS website is factsaboutfertility.org. And Lisa, I'll share direct links to our medical update, as well as, and I did not mention this, one of the big projects FACS did this summer was a review of all the fertility awareness apps that are out there, because many of them are not based on evidence-based fertility awareness methods. So we essentially went through and systematically rated and evaluated each one. So I'll share links to that as well. And then they should certainly check out our research section for more of the information about using fertility awareness-based methods to treat infertility, because that's a real issue for many women as well. So if you can share these links with your listeners, that would be fantastic. I'd appreciate that. But they can certainly visit us at factsaboutfertility.org. As I said, like us on Facebook and follow us on Twitter at facts_fertility.
Perfect. And you'll find those links on the show notes page for this episode. Well, thank you so much, Dr. Duane. It was a pleasure. Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/123. I really enjoyed my interview today with Dr. Marguerite Duane. I think what I enjoy the most about her work is that she's really getting at that thing that after, especially for my longtime listeners who've listened to the show over the past, over 2 years now, is just whenever a woman learns about the fertility awareness method and learns this important life-changing information just about the basic functioning of her reproductive system. The response is very consistent. It's, this is amazing. Oh my goodness, it's so exciting to learn this. And then it kind of shifts oftentimes to frustration and sometimes anger, which is, why didn't we learn about this? Why doesn't everybody learn about this? And especially, can't even imagine what it's like to go through med school as a doctor and to, you're a doctor, you just went through med school, and then to learn that you still have so much more to learn. And then to kind of wonder, why aren't all doctors trained this way? And what I love about the work that Dr. Duane has done is that instead of just kind of stewing in that place of frustration, she went ahead and created an organization specifically to teach physicians and other health professionals so that they're better able to care for their patients. So I think that is really important to give hope, especially for, like I said, the listeners who've been listening to this podcast for a while. I think it can get a little bit frustrating, and especially if you've had your own kind of negative experience seeing your physician and trying to explain to your physician that you're using fertility awareness, or trying to request a test at a certain time of your cycle, to just kind of be laughed off the chair in the doctor's office. I mean, me personally, when I had my miscarriage before my first pregnancy, I tried to explain to my doctor that I ovulated. I don't remember what day. It's been several years now, but I think I ovulated somewhere around, say, day 21, 22, but fully at least a week past day 14. And I tried to explain it to him, and I was just laughed off the chair. Like, he was not even trying to hear that. It was like I didn't say anything. Like, it could not sink in. And so for all of us who've had those really frustrating experiences with our physicians and kind of start to lose hope and wonder, if there's anything that we can do, I think it's really refreshing to hear from a medical doctor who has taken it upon herself to create an organization specifically targeted at improving the education and awareness around these issues, specifically geared to doctors. And what I love, it's like, by doctors, for doctors. So rest assured, there is hope. There's a lot of amazing women and men out there that are really working to get this information into the mainstream. And I am so honored to be part of the movement, because obviously I couldn't sit on my hands and just be frustrated. I had to share this information with as many women as I could. And so I think all of us are part of this movement. If you're listening to the podcast and you've been affected by it, and you're finding yourself in that place where you do wish that it was just standard education and that every woman had access to it, you're not alone. And so I think we just have to keep kind of quietly stirring it up and trying to continue to get the word out. And so if you've been enjoying the podcast, I would love it if you would look for it on iTunes and leave a 5-star review. That helps more people to find it. It helps the show to move up in rankings. It helps to extend the reach of the show. And I really appreciate all of you who have left reviews already. It's really incredible. If I ever am having a bad day, I can just go to the iTunes reviews and read through all of the wonderful comments and just the honest, reviews of the show that you've shared. And I do read all of the comments and all of the reviews. And so I really appreciate that. And I really appreciate all of you who keep sharing the show. You share it with your friends. I've had clients tell me that they found out about the show from their Arvigo practitioner or from one of their girlfriends. So I really appreciate all of you, out there spreading the word and sharing the show. It really does make a difference. And I think that the biggest compliment that I get is to know that someone has shared the show or tagged their friend or forwarded a Facebook post or something like that. I really appreciate all of that, because I can see that it has made a really big difference in the reach that I have, and it just helps to keep the momentum going for the show. And make sure to head over to fertilityfriday.com and join my email list if you haven't joined it already. So as a gift to you, when you join my email list, you'll receive a copy of my ebook where I talk about what to expect when coming off of hormonal contraceptives. And I also share 5 steps to restoring healthy menstrual cycles if you've recently come off of a pill. And if you do have a guest suggestion, an idea for a podcast episode, please send me an email at info@fertilityfriday.com. And I'd like to thank you for hanging out with me today. I appreciate all of you for taking the time to tune into the podcast and let me be part of your busy days, whatever it is that you're up to today, whether it's walking the dog or doing some laundry or something like that. Thanks so much. And as always, until next time, be well and happy charting.